I have the great pleasure of being here with Larry Cornish at Mark Twain St. Joseph's Hospital for another one of our quarterly little updates on what's happening at the hospital. Thank you, Larry.
You're welcome. Thanks for inviting me again.
for me invading your conference room, is that
whatever.
Now, you've got a lot of stuff going, but one of the things we want to start off on a little bit of a happy note. You guys are having a wedding here in a few minutes, aren't you?
Yep, for sure. It'd be to my knowledge, it's the first one you've had here, at least in the new hospital.
Right.
We had a patient, female patient, who wanted to get married in our chapel. So, she's obviously healed and
right,
and now gone away, and she approached us a couple weeks ago to see if there was any possibility that she and her future groom could be married. So we have a wedding that's going to be
nice.
this morning, later on this morning.
Now, did they meet?
I have no idea. And to be quite honest, I don't even know their names. But no, we have a cake, and we're doing a nice reception, and the press is invited. If you want to stick around, stick
around for the wedding. Yeah.
All right. You might get a piece of cake or something.
Very cool.
But it's kind of a special event for us. It's going to be fun, and our pastor, Michael Jordan, not the Michael Jordan, but a Michael Jordan, is going to be doing the service, and it's his first wedding that he's ever done.
So, and also, I guess, so you're expanding into more of a full-service facility. Is that the?
Well, in the economy, you do what you gotta do.
You gotta do what you gotta do. I guess that's our segue. I guess one of the things we wanted to talk about today was, everybody's concerned about the economy. I mean, you see, the numbers are trickling in that I guess we've officially been in a recession since last December. What unique challenges does it pose for you guys? I mean, how does it affect us as a hospital?
It's amazing. If we had had this conversation 6 months ago, we probably wouldn't have had the conversation.
Right.
Because we wouldn't have thought that the economy would affect healthcare as it has. We've been affected to some degree. There is a effect in healthcare of the economy across the nation. Doctors' offices, hospitals, insurance companies.
Right.
Everybody's affected now because of the economy. What hospitals have seen, and I can speak mostly for hospitals,
sure.
They have seen a decrease in surgeries, admissions, anywhere between 5 and 20% across the nation. It seems to be worse on the East Coast, and kind of moving toward the left side of the states. And we actually have seen a loss of elective type surgeries and procedures. So people that would be going to the physician for their annual checkup may be postponing that a little bit, so they don't have to handle the copay issue.
Okay.
If they had a total knee replacement, they may be postponing that because they don't want to put out the money for their copay. So we're not as busy as we typically have been or would be at this time of year. But nobody else has been busy either. Physicians' offices are slow. So, what are we doing about it?
Yeah. Do you see acute, before we move on, do you see acute care up, or is it about the same?
We haven't really seen a trend. We worry that people are going to stay away from their physician or stay away from the emergency room as long as they possibly can, and what we fear is that they'll become more acutely ill, and their treatment will be even more costly, and it'll take them longer to get back into their lifestyle. So we worry about that a little bit. There's nothing to support that. We just worry about it. Yeah. So one of the things we're doing is that we're trying to get out consistent messages, not only to the public but also to our employees, to let them know that yes, we're a little bit slow. We're doing well as a hospital. We just need to get through this economy issue. Yeah. These people are certainly going to return at some point in time for their elective surgeries. We have put a freeze on hiring just because if we're not busy, we don't need as many employees, so we don't need to hire anybody, and that's prudent for any organization that's suffering because of the economy. We're doing some things like freezing capital projects when it makes sense.
Right.
Now, certainly if you have a capital project that involves life safety, if you need to buy a ventilator because you have a ventilator that's not good, you buy a ventilator.
Right.
In fact, we just bought two new ventilators. So those type of purchases we continue to do. Some of our family medical center constructions, we've kind of slowed down that process, and we're re-looking at those to make sure that we move forward as a priority with the ones that make the most sense for the community and for the hospital. We're looking at things that provide us with good stewardship of our resources. We have felt it in our investments, just like everyone has felt it in our investments, and our purchasing power is not as strong as it was a year ago, and that's across the nation.
People still probably want to loan money to hospitals, though, right?
I don't know. I think that for major projects, that money's getting tighter out there.
Yeah.
And if your investment portfolio is down, the inclination from a lender would be that you're going to pay a higher interest rate.
Right.
Or maybe I'm not going to loan you the money.
Right.
So I think everybody's feeling the pinch. And we are. We are. And employees are kind of wondering. So that's why we're getting out the consistent messages, so everybody hears it from the executive council, for instance.
Right.
And doesn't have to go through a bunch of filtering process to hear what's going on. But we are doing good. We've got some great contracts that we're working to that have helped us, but it is not as busy as we budgeted for.
So you're going to run a Christmas special on knee replacements and that kind of...
I don't think so.
Okay.
I don't think
so. Now, I guess, but you've also had a pretty successful run of like the mini health fairs, haven't you? Is also ties into some of the economy things. You can do screenings.
Well, it's part of the preventative maintenance type thing, and we have always done health fairs and mini health fairs, but this past year and in the future we'll continue to do even more because in Calaveras County, I keep harping on this, but it's Calaveras County is unique. You have these little populations of people, and that's different than, say, Jackson, where everybody lives in Jackson, in Amador County, or Tuolumne County, where everybody lives in Sonora. But we have these population pockets, and people don't like to travel, and they're going to delay their health care or their testing, so we go out to them. Most recently, we did a mini health fair for the Greenhorn Creek residents, and some of the people from Angels Camp then came to the mini health fair too, and it was real well attended, and we did the flu shots and we did pneumonia shots and the typical stuff. We also did one
in the golf cart as they were. It was the drive.
No. That's right, drive-by shootings, so to speak. But we did one out at Ironstone. Ironstone, as everybody knows, is one of the biggest employers in the community, and they have a contract with our occupational health group, and asked us if we could come out and cater to them for flu shots and pneumonia shots, blood pressure checks, blood tests, those type of things. So we spent a morning out at Ironstone, and I don't know how many patients we saw or how many of their employees, they're not really patients, how many employees we saw, but it was nice to be able to go to where the population is. In this case, it was a business. And we'll do more of those. We're going to do one across the street of the government center after the first of the year. They've asked us to come over and do a mini health fair for their employees. And public health would be involved, with that as well. We're also going to be doing a mini health fair down in Valley Springs after the first of the year, and then Arnold, assuming that there's no snow on the roads, or maybe, hopefully there will be snow on the roads. But those are some of the mini health fairs that we see coming up. We've also done a couple. We did the American Association of University Women came to us, probably 6 months ago, and wanted to know if we could help them with a program on heart disease. And of course we said, sure.
Sure, yeah.
And so a couple weeks ago we had the opportunity to have a lunch and learn with their organization. And we had Dr. Naluri, who is on our medical staff with Stockton Cardiology, who was our keynote speaker. And here on campus, and the ladies had a great lunch and learned about heart disease and how to prevent it and what happens if you get it, and talked about exercise and the importance of nutrition and things like that. It was a great community benefit, and I encourage any community organization, if they would like to do something similar or have us come to them and do a presentation. We always have people that are qualified to do that, and we can tailor something specific for you. Just give us a call, 754-3521, and we can accommodate that without any problem. One other thing, I know you're anxious, you're just chomping at the bit to ask another question. But in January, every year, Catholic Healthcare West has what is called a community grant program.
Okay.
And our hospital asks or invites community organizations to apply for community grants for projects that parallel our mission and values.
Right.
And I think that this year we had 11 organizations who applied for funding for their projects. And in January, we're going to be very proud to announce that 2 of our local organizations will be awarded funding for their projects.
Very nice.
And we'll make a formal announcement. We'll do a press release. You'll get it on the pinetree.net. And we'll have a celebration for them down in, we're going to take them to lunch and make an announcement along with other hospitals throughout the area. It's going to be a lot of fun.
Oh, yeah.
And we look forward. I wish I could release the names and the amount of because they're significant.
Stay tuned things. Now, as far as over the holidays, what you guys probably got all kinds of stuff planned over the holidays, right?
The things that we don't have planned are things like mini health fairs.
Right.
We try to stay away from that.
Right.
Now, holidays are special to everybody. We try to concentrate on those things that are healthy for our employees and their families, and celebrate the seasons with the community.
Now, do you bring in a chimney in each room? Is that so
Santa visits us actually
through the ventilation system, or is that? No, I'm just kidding.
Let's see, how would that work? All the smoke dampers. But we do celebrate the holidays. In fact, there is a fireplace that is being installed down in the emergency room. In all of the emergency room, nurses and technicians and medical staff and some of the EMTs will hang their stocking there, and it looks
so that's neat. So if Santa's watching, so you want to look for the one in the emergency room. That's right. The easiest.
How he gets from the ICU down to the emergency room, I have no idea, but I guess that's his problem.
All right.
So that's kind of, those are the type of things we're doing. We had a great holiday physician celebration last night, where we invited all of our physicians and their office staff to join us for
It's really a great staff, right? I mean, you've had some good recruitment. I mean, he's some really
we are very blessed with the physicians that we have here. And we have a couple more coming right after the first of the year that I can't talk about, but they're on their way. So that's pretty exciting. And we have then our holiday party, which community doesn't care about, but we're going to have a lot of fun Saturday night for our holiday party at Ironstone Vineyards. And then on Sunday, for our children, we have what we call the Polar Express, where we invite in our children from the employee base, and we sit them down in our front lobby in their pajamas, and we read them the story of the Polar Express, and Santa comes down the hallway with his bells, and
very nice. And
we give out raffle prizes and eat cookie and milk and hot chocolate, and the kids make reindeer, and it's a full crafts day, and it's a blast. And the train, imaginary train comes through. I'm the conductor.
Oh, you are the conductor.
So it's kind of
Did
fun.
you do the paint job on the train and everything else? Is it Is it a customized imaginary train? Or?
No, it's just an imaginary train.
Oh, yes.
that's really imaginary.
just kidding.
I blow a whistle, that's it. But and the kids kind of wonder, well, no, board the train. Where's the train?
Yeah.
It's over there. Sit down, kid. Shut up. No, it's a lot of fun, and I think we're going to have about 40 kids there.
Okay.
I'm going to have
right.
some of my grandkids will be there. So that's kind of how we celebrate the holidays
Right.
with the families. And then we have a big open house next Friday where you can just kind of roam around and eat food. And then everybody celebrates the way that they should with their families.
You know, I think it's a really nice thing that you guys have done, you know, with the teddy bear clinics and everything. It's kind of, you're interacting with the community in a way that's not always acute. You know, I mean, not always just acute care. I think it's been nice to see. I mean, it's a very, you know, kind of think of the hospital as a fun place to go.
Well, that's kind of interesting. It's not really a fun place to go, but I think that there's more to your community hospital than just medicine.
Right.
It has to be seen as a leader in health, regardless of what type of health it is.
Yeah, and I guess, and I didn't mean to fun, but I guess you allow a lot of community groups to use some of your classrooms, and I was even noticing on the board. So I mean, is an incentive for jury duty? Don't they get free lunch? Isn't that the?
Yep.
Yeah. So I mean,
so if you're a jury member, you'll get a little ticket from your juror's guy. And you can come over and have lunch at Carmen's Restaurant. Right. And we expanded that to the grand jury just this last week. And we had 19 grand jury members join us for lunch this week. And it was nice to have them on board because they really work hard as grand jury members for a year. So, and what we see out of that...
Healthcare Mall. No, like the food court. And,
Starbucks.
Yeah.
And get your tires kicked or something. I don't know. But you know, the jurors in Calvert County, they come from everywhere, every corner of Calvert County, and many of them have never seen the hospital. Right. So this gives them an opportunity to see what the hospital is all about, for feel our hospital, and so we really are. What a great idea! Yeah. You know, I can't take credit for it. I wish I could. Oh, I will take credit for it. No, I can't. I wish I could.
Well, I mean, where does that leave us after the new year? What do you guys got planned?
Well, we talked about health fairs,
that
we're going to be doing in Valley Springs, and I guess where there's probably three things that we ought to talk about. First of all, you know, we really understand the hit that the food bank has been taking. Right. And we are going to do a food drive after the first of the year here at the hospital that anybody in the community can take part in.
Well, we'll probably actually needed more than... I mean,
we need to replenish your stock.
Yeah.
So, you know, if you have a turkey that you got free from Save Mart and you have no place to store it, bring it to the hospital. We'll keep it under the freezer. And then after the first year, we'll get them over to the food bank. Cans, you can bring them to the 4 family medical centers that we have. Anything. And all our employees are all going to be donating. And then we hope to fill up a van full of food. Right. Which is going to be a huge help to the food bank and our more needy people throughout Calvert County. So we're looking forward to doing that. We also are going to be starting 2 programs. One in March called our Family Fit program. And I think we might have talked about this on the air before. It deals with child obesity. Right. We, with our Take It to Heart Foundation, have rolled out in Calvert County the Family Fit program for 4th and 5th graders in all of our elementary schools. Right. But there's some kids that fall out of that. They have no place to go. The physician cannot refer them to anywhere until they're 18. So we're going to start this hospital-based Family Fit program in March, which is education. It's working with the family on nutrition and exercise, with the whole purpose to get kids fit.
So that'll be a different section in the healthcare mall. You'll have a fitness center.
That's right, a fitness center. Good idea.
Just kidding.
Have to expand.
Yeah.
So that we're excited about that, and it's run by our 2 dietitians, registered dietitians, and you know we're in the planning stage of it, but we expect to roll it out in March. The other one that we're working on, very similar. This one is to reduce the readmissions. Excuse me, had a bubble. The readmissions of persons with diabetes to our hospital. And what our goal is to reduce these admissions by 5% by June, this coming June. So we have 6 months to pull this off. Again, our dietitians are taking the lead role in this, and whenever a person is admitted with diabetes to our hospital, they will begin a structured evaluation and put together some treatment plans and work with the patients however is necessary so that they can better manage their diabetes with the whole purpose of keeping them out of the hospital.
Right.
And so we hope to have that, well, we've been working on this for 6 months already in the planning stages, so we're excited about that. So that's kind of where we see coming on. Of course, then you got all kinds of other programs that we're dealing with.
And I think we want to say, from a lot of us in the community, is thank you for what you've invested in our county. Continue to invest. I know that in tough economic times, having a business like yours and an institution like yours, it adds a huge measure of stability to the income segment, to the job market, and also in a lot of ways. And I don't think people can underestimate that.
Well, thank you. We feel like the community looks to us to lead them in getting through this time that we're in, and whether it be providing health care or finding alternative insurance programs or helping with the food. We're doing what we can, and we're working hard at it.
Thank you.
You're welcome.